Well, it is emerging that COVID-19 patients currently at one of Ghana's facilities in Accra are increasingly showing diarrhea and other stomach-related conditions. That's according to Commanding Officer of the Elwak Level 2 Isolation and Treatment Center, Colonel Thomas Akwenas Bire. He says he made the revelation amidst a strong warning for people to take the pandemic seriously. Colonel Bire was speaking to JoyNews on the sidelines of a presentation by the United States Embassy here in Ghana.
Since the outbreak of COVID-19 in Ghana, there have been some who still do not believe the disease is real, despite the country recording over 100 deaths. Such persons often come up with their inability to see the lives lost to the disease as claims for their doubt. But speaking on the sidelines of a presentation of critical medical supplies by the US government to the Elwak COVID Centre, commanding officer of the facility called on such skeptics to erase that erroneous perception and accept the reality.
Well, some people want to see the dead people feely before they believe, but they should not wait till we get there. So we should not take it for granted. It is real and people are dying of it. If you haven't seen a person die or somebody close to you hasn't died of it, you count yourself lucky and pray that you don't get there. We have seen it. We've seen them coming with all sorts of presentations. The other thing is that it's not that typical cough, sore throat. We are seeing more people with gastrointestinal signs and symptoms, abdominal pain, diarrhea, and all that.
According to Colonel Bire, since the establishment of the center, he has recorded 2 deaths.
Unfortunately, we had some deaths recently. We had 2 deaths in the center recently. But the secret lies in monitoring, constant monitoring. And so even with the ICU, for instance, where you need to be there constantly, but which is not practical in this situation. We have CCTV cameras that view the patients and the various monitoring devices. And so we go in as frequently as possible and we have somebody monitoring the CCTV cameras. And so when there's a need to intervene, we quickly do that.
Just like other health centers, issues of PPEs has been a major challenge. So this gesture by the US, according to the commanding officer at the center, is very timely.
In IT terms, they gave us the hardware. They've come to give us the software, which we need to do the day-to-day work. And so it's a very great presentation and support that has been given to us. And looking at the items, they're exactly the items that we need in terms of the medications that we use for COVID patients: vitamin C, zinc, hydroxychloroquine.
Meanwhile, Major Michael W. Camara, chief at the Office of Security Cooperation, U.S. Embassy, says the donation by the U.S. government forms part of emergency response efforts by the U.S. to the Ghana Armed Forces.
Our donation today to the Ghana Armed Forces here at Elwak Stadium is really a continuation of our support that we've provided to the Ghana Armed Forces with our donation of these state-of-the-art Level 2 hospitals that we donated earlier this year. The hospitals were originally donated for the Ghana Armed Forces to use during their peacekeeping deployments, and it was a way that the United States could support the wonderful work that the Ghana Armed Forces does abroad in all of their support to peacekeeping. And so their ability to use these hospitals to fight the COVID-19 pandemic is truly a testament to the professionalism of the Ghana Armed Forces, and it really shows the advanced relationship that we have between the U.S. military and the Ghana Armed Forces.
Items donated include 10 glucometers, 1,000 liters of disinfectants, 2,000 N95 masks, 700 disposable gowns, 10 infrared thermometers, 2,000 tablets of zinc and vitamin C, among other items. Beryl and Estina Richsters report for JoyNews.